Thank you all for joining us tonight. We're excited you could be here. Allow me to welcome you to the Xseed product training call. My name is Susan Nicholas. I'm the Director of Marketing and Promotions at Xseed. Tonight's topic is our top-selling weight management product, Slender. Ladies and gentlemen, let me introduce you to Xseed's Director of Research and Development, Dr. Leslie Jacobs. Take it away.
Well, thank you very much. Welcome, everyone, to Ask Dr. Leslie. I am Dr. Leslie Jacobs. I'm a board-certified internist and Director of Research and Development here at Xseed. And I'm calling from our corporate headquarters in Las Vegas, Nevada. And I got to tell you, it is a beautiful day here in Vegas. Oh, I don't know, about 82 degrees, much warmer here than what our executive friends out there in the East Coast are probably experiencing right now, and certainly much drier than our executive friends out in Orlando, Florida are also experiencing right now. So I'm just really excited about our new series that we are actually beginning officially today. So I'm going to go ahead and explain our format to all of you. Today is the first of a series of sessions that I will be audio casting for all of our executives throughout the entire country. And this format is going to be a little different each week, and we will be addressing some of the pertinent questions that are out there in the field. Some questions that you may have yourself, or maybe some questions that you've been asked out there as you're prospecting and sharing the products and the experiences with your friends, your family, and your coworkers. But let me start by saying that the information and the statement that I'll be sharing with you have not been evaluated by the Food and Drug Administration, and our products are not intended to diagnose, treat, cure, or prevent any disease. In addition, the information that I'll be sharing with you is not intended really to be taken as medical advice, and no therapeutic or medical claims are either implied or made. So don't alter any medical treatment or the use of medication without the permission of your healthcare provider. And the FDA regulations prohibit the use of therapeutic or medical claims in conjunction with the sale of any product not approved by the FDA. So with that being said, today's product pick of the week is Slender. And let me just start by talking about weight in general, being overweight for that matter, obesity. So how does one determine, or how do you determine if you're overweight, and what measures do we use nowadays in making that determination? If you're considered to be normal weight or overweight, obese, or even really considered morbidly obese. Well, nowadays we use the BMI, which stands for Body Mass Index, and we use the chart. So the BMI determines, as I just mentioned, if you're of normal weight, overweight, obese, or even morbidly obese. Now the CDC, which stands for the Centers for Disease Control and Prevention, tells us that more than one-third of the U.S. adult population are actually considered obese. That's close to 35%. And keep in mind that obesity-related conditions, including things like cardiovascular disease, and that also includes hypertension and strokes, type 2 diabetes, arthritis, sleep apnea, and several others. So being overweight, it puts you at risk for those type of conditions. In addition, there's even some obesity-related cancers, and those include things like esophageal cancer, pancreatic cancer, there's colon cancer, kidney cancer, bladder cancer, post-menopausal breast cancer, and several more. So for adults to determine if you're overweight or obese, we use the weight and height to calculate this number called the Body Mass Index, what we call the BMI. And this BMI is used because for most people, it really generally correlates with their amount of body fat that they have. Now, as an adult, if you have a BMI between 25 and 29.9, it's actually considered overweight. A BMI between 30 and 40 is considered obese, and over 40 is actually considered morbidly obese. So when we're done with the seminar tonight, I want you to go online to webmd.com, and you'll find a BMI calculator that you'll be able to plug in your specific individual numbers or information, and then it will calculate your BMI for you. So then you get your baseline that way, where you're starting, where your start point is as of today. Make sure you do it as soon as we're done. But understand that although the BMI correlates with the amount of body fat you have, it does not necessarily directly, actually it does not directly measure body fat. So as a result, some people like athletes, for instance, may have a BMI that identifies them as overweight even though they don't have excessive body fat. But the BMI is only one of the indicators for potential health risk associated with being overweight or obese. So keeping that in mind, what else do we use in assessing someone's likelihood of developing overweight or, obesity-related diseases? Well, the National Heart, Lung, and Blood Institute guidelines recommends looking at two other very interesting predictors, and that's your waist circumference, because abdominal fat, the fat around your belly, is actually a really good predictor for obesity-related diseases. In addition, other risk factors you may have for diseases like conditions associated with obesity, for instance, things like high blood pressure or even physical inactivity. Now, why is this all important? Well, as you can only imagine, being overweight goes way, and I mean way beyond our outward appearance and just being tired of the way you look. Now you have to realize that it has much more far-reaching consequences for your health presently and in the future. So our first question is from Orlando, Florida, and their question is, what differentiates Slender from other weight management products on the market? Well, great question. Basically, number one, the type of ingredients we have in Slender. Number two, the potency of the ingredients. Number three, the amount of the individual ingredients. And then four, the combination of the key enhancers that we've actually included. And lastly, number five, the research and the science supporting several of the individual ingredients that we actually selected and have put in Slender itself. So with that being said, let's talk about Slender in general. We have assembled an all-star team of metabolic enhancers that basically helps, support a healthy metabolism, helps limit the production of fat and fat cells, also helps support the breakdown of fat and fat cells, helps manage one's appetite, curbs cravings, and supports what we call leptin sensitivity. In addition, helps to support healthy adiponectin function. Now that's a whole lot of information that I just threw out there, but how? Well, this kind of leads us into question number two from our friends in Arkansas. What is Garcinia cambogia? How does it work? And what percentage of HCA is in our Slender? Well, that's another great question. Well, Garcinia cambogia is, let's just talk about the basics of what it is. It's actually a small pumpkin-shaped fruit, sometimes called tamarind, and it's grown in many different countries and has actually been used in traditional South Asian dishes, including foods like curries and even chutneys. Now, the key ingredient from the rind of the fruit comes actually from the rind of the fruit, and it's the natural extract, and it's called hydroxycitric acid. And we abbreviate it by just calling it HCA. HCA. It is well known for its weight management properties, as HCA, hydroxycitric acid, actually blocks fat by inhibiting a really important key enzyme that's in your body that your body needs to make fat from carbohydrates. This enzyme, the specific enzyme, is actually called citrate lyase. Now, in normal circumstances, when one eats carbohydrates, like examples, breads, potatoes, rice, pasta, sweets, or fruits, just to name a few, well, these carbohydrates or sugars are not the ones that are not used immediately to create cellular energy or for short-term access for future storage. Well, the remainder of that excess carbohydrates goes and forms fat. And as it accumulates and accumulates and accumulates, and you can only imagine accumulates even more, what I like to refer to as into our fat storage warehouse, well, that's the area that's around your belly, around your thighs, your buttocks, or even around some of the key organs in your body. So back to the HCA. When HCA inhibits citrate lyase, the fat-making process is now slowed or halted to some degree, and then the production of LDL, which is your bad cholesterol and triglycerides, also subsequently theoretically decreases. It also has been suggested that HCA also manages the appetite by actually increasing a specific neurotransmitter in your brain. And this neurotransmitter in your brain actually gives you a feeling of just well-being. When that happens, then it supports better control in managing your appetite, and when you eat less, then your body senses it, and it releases stored fat in your fat cells to now be utilized. And the second part of that question was, what percentage of HCA is in Slender? 60%, and that is a really, really good percentage that's found in Slender. Question number 3, Well, question number 3 is, why is so much emphasis placed on this particular African mango that we have in Slender? And what is IGOB 131? Well, not all African mango supplements are the same. Now, here's the difference. They all may contain extracts from the pitted African mango, but only one specific extract was actually successfully used in the African mango weight loss clinical study that was published in the Lipids and Health and Disease publication in March of 2007. So any of you inclined to look up that published article, it actually is in the Lipids and Health and Disease publication, March 2007. Well, this was the first randomized, double-blinded, placebo-controlled clinical trial illustrating the modulating benefits and effects of African mango. This is the patented IGOB 131, and this is the specific patented African mango that is found in Slender. The African mango is also known as Erviginia gambiensis. So when people refer to African mango or Erviginia gambiensis these days, they're really referring to an extract from the pit or seed of the African mango fruit. Very, very few supplements contain this patented extract, but we have it in Slender because it is really quite expensive, so most products don't have this IGOB 131. You're going to find it very, very rarely, but you'll find it in our product, and it's worth every penny of it. Now, question number 4, how does it work? Well, African mango basically just supports healthy leptin sensitivity, and that's the hormone that's released from the individual fat cells. It's responsible for communicating all the way up to the brain and telling it how much fat is actually in the fat stores. Now, when leptin successfully and properly communicates with the brain, it helps to support and manage the appetite and the communication between your fat stores, sites, and then your brain. So the more body fat you have, unfortunately, your brain develops what we call this leptin insensitivity or what we call leptin resistance, and that ultimately impacts proper communication. African mango also supports healthy adiponectin activity, and that's another hormone protein that is involved in the metabolism of lipids and in glucose. So that's African mango. Now, question number 5. Now, this next question is coming from Los Angeles, California, and they ask, what is the benefit of using Capsimax over capsaicin in Slender? Well, to start, it's important to understand that capsaicin, or better yet, capsaicinoids, which is the active individual ingredient of the capsaicin, it's the potent ingredient of it, are known for their weight management properties. So that's a really good question. Capsimax comes from a company called OmniActive Health Technologies, and it's one of the best in the world when it comes to this type of ingredient. And it's actually an award-winning product created using these omnibeads. Now, these omnibeads is a patented process using this beadlet encapsulation technology that allows the benefits of this pepper, all the benefits, all the weight management benefits and properties without the burn of the pepper. So just think about it. You've got this capsaicinoid, and it's wrapped around, and it's encapsulated, it's engulfed by this beadlet technology. And this beadlet technology allows it to get released, not in the mouth or in the stomach, but waits to go all the way into the small intestines where it activates the receptor, and then a cascade of metabolic reactions start to occur. Now, capsaicinoids, again, for their weight management properties, basically helps to support healthy metabolism. In addition, it helps manage the appetite and supports the breakdown of fat in fat cells. So this pepper, this proprietary formulation, this Capsimax that we have in Slender, basically encapsulated, it's highly concentrated, it's a natural fruit extract to provide a very highly effective, active capsaicinoid without, again, the oral, meaning the mouth, or the gastric, meaning the stomach irritation of an unprotected red-hot pepper. Again, as a result, we get the weight management benefits without the burn because we're using this innovative, highly technological, patented process using the omnibeads from OmniActive. So question number 6 comes from Utah. And their question is, I've heard a lot of different things about raspberry ketones, but what are the actual benefits of it? Well, research has shown that raspberry ketones has many, many weight management properties, especially when paired with exercise and a good balanced diet of healthy foods. Raspberry ketones is it's the primary aroma compound of the red raspberry, and it helps to support and regulate adiponectin. And that's the protein I spoke about earlier that's involved in the proper metabolism of glucose and lipids. And in addition, it also helps the body in supporting just a good, healthy metabolism, and also supports the breakdown of fat in fat cells. Red raspberry ketone is one of those really hot topics nowadays, and we have it also in Slender. Now, question number 7. How does green coffee bean extract that's found in Slender differ from the green coffee bean used in coffee? Well, green coffee bean extract in general refers to the raw or the unroasted seeds or the beans of the coffee fruit. Now, this raw or unroasted bean is what's found in Slender. Now, in contrast, to make coffee, what you do with the coffee beans are you clean them, you dry them, you roast them, you ground them, and you brew it. Well, coffee contains hundreds of components, caffeine being one, but the very other important component is chlorogenic acid, along with several other compounds. But it's this chlorogenic acid specifically that has weight management properties. And how? Well, specifically, it's been shown to inhibit a key enzyme called glucose-6-phosphatase. Now, this specific enzyme promotes the formation of glucose or sugar in the liver. So chlorogenic acid actually inhibits that particular enzyme. In addition, this chlorogenic acid, this key ingredient found in green coffee beans, has also been shown to actually slow the absorption of fat from the foods that you consumed, and then also activates the metabolism of extra fats. Now, this supports healthy insulin function in normal, healthy individuals, in addition to that. Now, traditionally, brewed coffee, as you can imagine, does not serve as a good source of chlorogenic acid because, again, the actual roasting of the green coffee bean removes not only the bitter taste, but also removes a fair amount of that chlorogenic acid. In contrast, found in Slender, the raw or the unroasted green coffee bean found in Slender is a really, really good source of the chlorogenic acid because it's not been destroyed from that roasting and that drying process. Keep in mind that green coffee bean is generally not very high in caffeine either. Also found in Slender, we've got some green tea extract and also resveratrol, just to name a few of the other ingredients. Now we've got another question. What is the best way to take Slender? Well, to maximize efficacy, it's recommended that you take 3 capsules 30 to 60 minutes prior to your larger meals twice per day. So as an example, we're just going to go through some examples. If your 2 larger meals are breakfast and dinner, then you'll take 3 capsules 30 to 60 minutes before breakfast, and then again 30 to 60 minutes before dinner. If your 2 larger meals are lunch and dinner, then you'll take 3 capsules 30 to 60 minutes before your lunch, and then you'll do the same before dinner. And following the same plan, if your 2 larger meals are breakfast and lunch, then you're going to follow the same program, 3 capsules 30 to 60 minutes before breakfast and the same before lunch. Now, if by chance you forget and it's 5 minutes before you're about to eat your bigger meal, remember to take it. Don't worry about it. Go ahead and take it. You do not have to take it 30 to 60 minutes before the meal, but we suggest that because it maximizes the efficacy. But if you forget and you're 5 minutes before you eat, I do not want you to not take it. Go ahead and take it, but try to remember next time 30 to 60 minutes. And it still works even if you take it 5 to 10 minutes before. Keep in mind, it maximizes efficiency when you do it that way. Now, in summary, Slender is our weight management dietary supplement, and we are basically incorporating whole all-star team of metabolic enhancers that basically, just in summary, supports, number 1, a healthy metabolism, supports the breakdown of fat and fat cells, limits the production of fat and fat cells, supports healthy leptin sensitivity and adiponectin levels, also helps manage the appetite, curbs cravings, and really should be an integral part of any weight management program when used in conjunction with a balanced diet, exercise, behavior, and lifestyle modifications. So this has given us, we're just kind of reviewing, giving a nice good summary of some of the questions that are out there that you may have, some of the questions that are getting out there out on the field. So we're addressing those questions and giving you a nice overall general summary of Slender. Well, my friends, this was a lot of fun. Thank you for joining me on this Ask Dr. Leslie, and please submit your questions to askdrleslie@xseedhealth.com. And we'll be addressing and answering your questions each and every week as we continue our series of sessions on this amazing, amazing line of products that we have and sharing with you at Xseed. So good night, everyone. Join me next Wednesday for our next session in Ask Dr. Leslie. Thank you so much.